Hello, I am Tina Johnson from United States University. I will be presenting a case study on type 2 diabetes mellitus. This case study is a 48-year-old female from Winnebago, Indian tribe. 3 years ago, the patient had high blood sugar and cholesterol levels. The blood sugar was 141 and her cholesterol was 225. The patient stated she felt fine and could not purchase any more medicines at that time. Her only other complaints were female infections. Today her complaints are weakness and numbness to her left foot, with the onset being 3 weeks. She states difficulty in flexing her foot. Her other complaints include increased thirst and frequent urination. She believes this is due to the warm weather and frequent hydration. She has gained 15 pounds in the last 6 months. The patient's past medical history includes seasonal allergies, a breast biopsy which was positive for a fibroadenoma, gestational diabetes with her 4th child, morning sickness with her pregnancies, hypertension, osteoarthritis to her hands and knees, yeast infection, which she treats with over-the-counter antifungal creams and salt baths, and constipation occasionally. A family history of type 2 diabetes is present in her sister and maternal grandmother. Sister is treated with pills and shots. Her maternal grandmother died from kidney failure. Her father was positive for emphysema, and the patient's other siblings and her children are healthy. The patient's physical exam revealed recent fatigue. The patient stated she also has blurred vision, dizziness, and lightheadedness when she stands. The patient had no chest pain, and the patient had no shortness of breath. The patient does state that she has occasional constipation. The patient also has frequent urination. The patient stated that her menses had ceased 2 years ago. The remaining exam was unremarkable. The patient did have some lab levels that were elevated, which are highlighted in red: her cholesterol, LDL, triglycerides, hemoglobin A1C, and her glucose. The lab that is highlighted in blue was lower than normal, which was her HDL. Diabetes is a metabolic disorder which is either diagnosed with chronic hyperglycemia or a disruption of carbohydrate, protein, and lipid metabolism caused by failure in secretion or function of the insulin, or both. The most common type of diabetes is type 2 diabetes that covers about 90% of diabetic patients. It is predicted that the number of patients with type 2 diabetes across the world will increase from 415 million people in 2015 to 642 million people in 2040. There is a higher incidence of type 2 amongst certain ethnicity groups. For all forms of diabetes, poorly controlled hyperglycemia leads to complications including retinopathy, peripheral neuropathy, and nephropathy, and a high risk of cardiovascular disease. There is a genetic disposition and environmental causes for type 2 diabetes. Environmental factors stress the glucose homeostasis system by promoting insulin resistance or worsening B-cell function. The lowered B-cell mass through genetic and B-cell cytotoxic factors is an important predisposing factor for glucose intolerance. As the blood glucose level rises a small degree above normal, this creates defects in the glucose homeostasis system. The first phase is impaired insulin response to a meal, which causes the blood glucose level to rise. This increase in glycemia in conjunction with hyperlipidemia causes deterioration in B cell function and resistance, resulting in blood glucose levels that continue to rise to create a diagnosis of diabetes. The signs and symptoms include frequent hunger due to limited breakdown of food for fuel can lead to weight gain initially, but this may turn to weight loss. Overactive kidneys cause the frequent urination, which in return cause an increased thirst. The three earliest signs are increased thirst and urination, and hunger. The other signs are fatigue, blurred vision, slow healing wounds, frequent infections in areas of darkened skin, and numbness in the feet. The diagnostic test that assists with the diagnosis of diabetes is a fasting plasma glucose, a hemoglobin A1C, random plasma glucose, and fingerstick blood glucose. If you'll remember, the patient complained of increased thirst and frequent urination. She believes this is due to the warm weather and frequent hydration. She has gained 15 pounds in the last 6 months, and the patient also stated she had fatigue and blurred vision upon waking. She also stated she had yeast infections. The patient has complained of numbness for 3 weeks in her foot with difficulty flexing. The risk factors that may predispose one to type 2 diabetes are obesity, being over the age of 45, if there is any family history, certain ethnicity groups, hypertension, hypercholesteremia, hyperlipidemia, gestational diabetes, a sedentary lifestyle, a CVA or heart disease, depression, polycystic ovarian disorder, and acanthosis nigericans. Remember, in the case study, our 48-year-old female had a history of weight gain, a family history of her type 2 diabetes, and her sister and maternal grandmother. She is also a member of the Winnebago Indian tribe. She also had a history of high cholesterol and gestational diabetes. The treatment for diabetes includes a healthy diet and regular exercise. The two assist with lowering overall A1C and controlling hyperglycemia. If not controlled by diet or exercise, then medications such as metformin or glipizide may be administered to the patient. The patient may also have to have supplemental insulin. There are home treatments, such as herbal treatments, but there is very little evidence to support the use, and further studies are needed. If the patient has consistent hyperglycemia, this may lead to long-term issues such as peripheral neuropathy, nephropathy, which can lead to dialysis, and retinopathy, which can lead to blindness. Health literacy for type 2 diabetes is key to the improved outcomes of the patient's compliance. Diet and exercise were seen as the two areas that lacked understanding, according to a study by Chahardra Charik and others. Diet modifications can play a major role in the controlling of diabetes and other comorbidities of diabetes. Understanding community resources for exercise and diet control are key for the practitioner. The patient is presumed to have type 2 diabetes mellitus. The patient will be placed on a consistent carb diet. The patient will have a dietitian referral for her meal plans. The patient will be instructed to exercise 3 days a week and provided with community exercise programs. The patient will receive a glucose monitor, education, and instructions on logging fingerstick blood sugars. The patient will be placed on oral medication to assist lowering her A1C. She will also receive foot care education. The patient will be made aware of any diabetic classes at public health department or at the local hospitals. Thank you for your time and attention. This concludes my presentation.